How does calcium interact with vitamin D in relation to blood pressure? Have you ever wondered how calcium and vitamin D work together to influence blood pressure? It's a fascinating connection that plays a role in our overall health. Let's break it down. Calcium is essential for many bodily functions, including the regulation of blood pressure. It helps control the contraction and relaxation of smooth muscle cells in blood vessels. When calcium levels rise in these cells, it can lead to vasoconstriction, which means the blood vessels narrow. This narrowing increases resistance and can raise blood pressure. On the flip side, having enough calcium can help keep blood vessels functioning normally and prevent excessive narrowing. Now, vitamin D comes into play by influencing how our bodies manage calcium. It promotes the absorption of calcium in the intestines and helps maintain calcium levels in the blood. When calcium intake is low, the body produces more parathyroid hormone and active vitamin D, known as calcitriol. This process helps balance calcium but can also activate a hormone system called the renin-angiotensin-aldosterone system. This system can raise blood pressure by causing blood vessels to constrict and the body to retain fluid. Vitamin D also has direct effects on blood vessels. Adequate levels of vitamin D can help regulate the renin-angiotensin-aldosterone system and reduce the secretion of parathyroid hormone. This can lead to lower intracellular calcium levels in blood vessels, promoting vasodilation, which is the widening of blood vessels. This process can potentially lower blood pressure. Research on calcium and vitamin D supplementation shows mixed results. Some studies suggest that taking both can lower blood pressure, especially in people with low vitamin D levels. However, large studies involving postmenopausal women found no significant reduction in blood pressure with combined supplementation over several years. This indicates that while calcium and vitamin D interact biologically, the impact of supplements on blood pressure may vary based on individual factors. From a hypertension perspective, maintaining adequate levels of both calcium and vitamin D is important for blood vessel health and blood pressure regulation. If either nutrient is deficient, it can lead to increased activity of parathyroid hormone and the renin-angiotensin-aldosterone system, which can raise blood pressure through constriction of blood vessels and fluid retention. In practical terms, ensuring you get enough calcium and vitamin D through your diet, sensible sun exposure, or supplements when needed can support better blood pressure control. However, it is essential to remember that supplementation alone is not a substitute for established treatments for hypertension. It can be part of a broader approach to cardiovascular health.